Good afternoon to all. My study is on the feasibility and acceptability of community-based health insurance in the northwest region of Cameroon. Studies have demonstrated that conventional health insurance is out of reach to the poor communities in Africa. And there is a scheme or a mechanism, which is the community-based health insurance, that has been put in place to achieve universal health coverage. And this strategy is based on the fact that participants in a community health insurance scheme come together to pool risk. As introduction to my study, financing quality healthcare is a major challenge in developing countries. It has been demonstrated that health plays a key role in the economic development of a country. For this reason, policymakers in developing countries have increased their efforts towards providing quality health care both in urban and in rural areas. Health systems in many low and medium income countries have been funded predominantly through out-of-pocket payments, and the negative implications of out-of-pocket payments are well documented, and these include reduced access to health services, contributes towards household poverty, and promotes gender inequalities, and generates little revenue amongst households. The study was conducted in Bamenda, the northwest region of Cameroon, and this was in preparation to pilot a community-based health insurance scheme in some communities of this province. And in this study, the feasibility and acceptability of a community-based health insurance scheme and its potential sustainability was analyzed. Out-of-pocket payments for health means that some low-income people do not have access or do not access needed health care, and many experience significant financial difficulties in paying for health services. An increasing number of people delay visits to medical practitioners or do not visit health facilities at all because of cost considerations. Universal health coverage means that all people receive the health services they need without suffering financial hardship when paying for them. And there has been a shift in health financing debates worldwide, away from out-of-pocket payments towards mechanisms that protect the population from catastrophic medical expenditures and income losses. And in our study, we did a mixed quantitative and qualitative study. So we collected quantitative and qualitative data to explore the variables of interest. Data was collected through a cross-sectional household survey with a sampling size of 372 households. And for the quantitative study and for the qualitative study, we did focus group discussions, and the focus group discussions were done in 8 focus groups across this province. Cross-sectional, for the analyzing our quantitative data, we did a cross-sectional household survey data, was entered into AP-Info version 7, and this was exported to SPSS and analyzed in SPSS to generate descriptive statistics. For the qualitative study, data recorded on the tapes during the focus group discussions were listened to repeatedly in order to get familiar with words. The tapes were transcribed in Pidgin language, which is the local Creole that's spoken in this part of the country, then translated into English by the field research team. This data was triangulated with the contact summaries generated immediately after each focus group discussion. For our results, we identified that a majority of the respondents for the household survey, which is 51.6%, were male head of households. For the educational level, most of them, 34.7%, were primary school leavers. When asked about their major source of income, 40% of participants reported being farmers. In all, 64.8% of the respondents were the main income earners of the households that were surveyed. For our results, participants demonstrated that financial protection is provided by community-based health insurance, and during the survey, 6.7% of respondents said this assertion doesn't hold. That is, community-based health insurance doesn't provide any financial protection for them. 14.2% said community-based health insurance provides low financial protection, while 50.5% were of the opinion that community-based health insurance provides a medium protection for financial protection, and 28% were of the opinion that community-based health insurance provides a high level of financial protection. When surveyed on the access to universal health coverage due to community-based health insurance, 4% said community-based health insurance doesn't provide any access to universal health coverage. 14.5% responded that community-based health insurance provides a low access to universal health coverage, while 53.2% were of the opinion that community-based health insurance provides a medium access to universal health coverage. And when questions on the fact that community-based health insurance improved health-seeking behaviors, there were 5.1% of respondents who said community-based health insurance doesn't improve health-seeking behaviors, while 48.4% were of the opinion that community-based health insurance improves health-seeking behaviors amongst community members. The findings have demonstrated that there was some level of understanding of health insurance due to some health insurance schemes already existing in the region, but key concepts and how health insurance functions were not well understood by the respondents. The majority of participants were aware that health insurance addresses the financial difficulties related to seeking health care. These are some references that we used in the study. And for our conclusions, we say formal health insurance schemes cover only a marginal proportion of the population in low-income countries due to economic constraints, lack of good governance, and institutional weaknesses. So in many communities in Africa, conventional health insurance is inaccessible to poor community members. So in some communities in Cameroon, they started to using the community-based health insurance approach, where community members come together, pool funds together to pool risks, and in doing this, it has been demonstrated, or this study demonstrated, that the community can have access to universal health coverage through community-based health insurance mechanisms. Formal social protection for the vulnerable segments of the population is widely absent, and this study has demonstrated that there is a general acceptability of the concept of community-based health insurance in the communities. Thank you all for your participation.